Good morning, everybody. It is Diane,
Hi.
Matt, and welcome back to OK Aussie. How are you this morning?
I'm
Do you remember?
paying the price for swimming yesterday,
Mm.
and my neck is sore. I've got too much edema, and my tummy's sore. I just feel very tired.
Do you remember what happened last night?
Not really.
No, so there was another
Guys,
neurological
when I
event
have
last night.
Tourette's attack, I don't remember everything, and when I watch the video, it's creepy because it's like
an out-of-body experience. Is that me?
I said that. I don't
Did I
remember
do that?
saying that.
Yeah.
So please, if anyone's got Tourette's, I really want to hear, just in case I've got something else going on
Sure.
in the mix. I
do.
need to know. Does anyone else feel like that? Like not your normal Tourette's-y maybe modes, but that are your baseline. Everyone has different
Your regular
baseline.
patterns,
Everyone
your
is
common
different with
tics.
Tourette's, right? We all suffer differently. Some are mild, moderate, severe, right? But I just want to know, like, do you forget what was said and done? And
In
it's
the
when
moment.
you watch a video, or it's if your partner tells you, or someone around you tells you, this is what you said, and you're like, I don't remember saying that. Let me know.
Good morning, Max. Would you like to say good morning to everybody, or are you just waiting for my muffin? My goodness me. So you're quite right. And yours is actually an exacerbated neurological Tourette's because you have a mixed mode neurology that goes off because of your genetic chromosome condition 22q. You can have seizures, many different types. You can obviously have the
wanted my brain
dystonia.
checked early back then.
Yeah.
That was before the seizures. Well, I actually had 2 seizures before. I had 2 seizures before seeing him, but the hospital told me they were once-off seizures that people get. And it's normal for people to get these once-off seizures.
Normal.
And I was like, okay.
Once off.
And at that time, I trusted
The system.
authority and the system as an autistic doing it alone, which
you
should
do.
have been. But we didn't know
Different.
the support needs I needed back then, and I was in very bad situations, and of course I paid the price for that. Like, the trauma is real, but oh my gosh, he's trying to take it.
He's been so cute.
He's trying to take it. You know
Hi.
why? When he was
Hello,
a baby,
gorgeous.
he used to fit there perfectly.
You don't fit as much anymore. You're growing, big boy. Well, I'm glad you talked about
That's his safe spot.
I'm glad you've talked about the Tourette's and brought that up this morning because it actually ties into part of the conversation I wanted to have this morning, actually about another condition, one of the many that you actually deal with. And it is pervasive. It's always been with you. But it actually is also exacerbated neurologically. We see it coming sometimes into your Tourette's. It can be actually co-joined at the same time.
Oh, really?
And that's the OCD, right? Obsessive-Compulsive Disorder. So I thought there's an article that I just saw flick up on my screen this morning. It's actually from the ABC.
What about OCD
It's called
are they talking
OCD
about?
is Often Misunderstood. Elena wants you to know what it
And
feels like.
people that
This is written
say
by
it's a
Tessa
joke.
Fleming from Haywire. That's the article that I'm referring to, just in case you want to refer to that one.
And also, like, I know sometimes it can come across like I'm making it a joke, but that's because I've got it. And I think when you've got it, you kind of like have that green card to make fun of it, right? Because it's to yourself.
You're dealing with it.
You're not
You
doing
have
it
got
to
it.
others. I would never do it in a way where I want you to feel some bad feeling because you have OCD or whatever the topic is I'm talking about. Because I'm
Tourette's
missing
particularly
genes,
comes
I
in.
have many different symptoms.
So let's actually start there, if I may. Diane said she's missing genes. Yep, she's not wearing jeans.
Puzzle pieces.
The puzzle here is that she's actually missing anywhere between 40 to 60 genes, but not in her body. And in fact, you're missing 3 million DNA building blocks, which is pretty significant at the end of the day. That equates to anywhere up to 185 clinical symptoms for a condition it's called 22q11.2 Deletion Syndrome.
I remember walking home from school and, you know, I was, of course, very nervous of stranger danger, so I was always very scared because my mum let me walk when I was too young to do it.
Way too young.
I had my brother for a part of it, but then my brother went to a separate school, and so it was very stressful. And I'd get home and have a meltdown because I didn't cope with it. And I basically would walk home and I couldn't step on the cracks. And remember how we had the square pavements
Yes,
with the
I do.
lettering in the middle?
Yes.
and then you'd have a
That's
crack.
the Shire
You'd
lettering
have a
normally.
hairline crack on some of them.
Mm-hmm.
I'm tiptoeing all around some of the obstacles because I could not. And if I remember in my head thinking, if I walk on the crack,
Yeah.
something bad's gonna
The
happen.
floor is lava, almost is the analogy.
Yeah.
Yeah, but I'm glad you actually brought that up. And it also comes into another mode. You got home and then have a meltdown. You've also got autism. Now, with Diane's genetic condition 22q, 20 to 30% will have autism. 40 to 60% will have ADHD. Tourette's is also predominant in this cohort, as is OCD, as are seizures. In fact, higher, 7 times likely more than the public threshold, a lower seizure threshold for having seizures, 65%
I'm
of your
late
cohort.
diagnosed too, so that's why they didn't tell me.
But look at the interplay. There's a lot of people who, when you talk about autism, and Diane is very autistic, classic autism, have a lot of comorbidities or coexisting conditions. So you might see a lot more Tourette's pop up in the cohort that have autism. You might see a lot more
ADHD.
Ehlers-Danlos. ADHD tends to go hand in hand, doesn't it?
Well, I met someone recently, and I know they are
Mm-hmm.
undiagnosed autistic because they're my generation, and it breaks my heart because that could have been me if I didn't get the right test and
Mhm.
didn't come across the right people
Mhm.
and didn't have the right. Because for me, I say half of my adulthood I didn't know, the other half I did, so that's helpful, yes. But the part where I didn't know, at least I knew though I had delays, I had issues and that. I did know that in my head, but I hid it from even you,
Yeah.
my children,
Absolutely.
and it was
You
a
masked
very
it. Hid it.
difficult thing. A lot of crying alone, a
Mhm.
lot of having meltdowns alone, a lot of shame that made me very, like I literally, when you take away the things you hide, you stop being you
Mhm.
completely. So even the good parts get hidden.
Also,
Very
all your
sad.
traits. So when you stop doing
All
the
my
traits,
traits
your
were hidden.
personality, your
I
behaviours.
became a robot. I felt
automaton.
like a robot.
Wow.
And
That's
it was
sad.
like living in a scripted TV show.
Now, again, it's interesting that you say that too, because a lot of female autistics mask so incredibly well. Male autistics get picked up a lot
I
easier.
felt lonely.
All of the data, all the research actually is to date has been done on males. So that's why females have gone underneath the radar for the discovery of a diagnosis of autism.
Because in Australia, they just, you know, when you're mildly retarded, hyperactivity,
Mhm.
they pass the grades for you regardless of whether
Through the
you
education
have passed
system.
genuinely.
Yeah.
Because,
They just keep
but
pushing you on. Some of
however,
that's the
I
problem.
will admit, primary school and high school teachers did fight for me to my mum, but in those days compared to now, thank goodness it's changed,
Thank goodness.
they are not allowed to take their kid out of school early or just, and I didn't have adequate schooling as a child. I skipped the whole of year 3 because I went overseas.
Mm-mm. Not for your choice, but yeah.
Not my choice, and I missed a lot going
And that's a
to
foundational
self-sufficient
year
place with my auntie and uncle
off
where
grid.
there is no schooling,
No,
but
homeschooling.
but you do learn a lot.
But not by
though.
people
But
who
you
are
do learn a lot,
educators.
but not ABC 1, 2, 3.
No, because they're not educated. They might be teaching you life skills of here's some
Well,
gum
I
nuts, how
got
to collect the
to-
gum nuts, but it's not
I got to
ABC
do
1, 2, 3,
my
as you say.
only playing, which I never really had with my peers all
the
through
free
school.
play.
I never had a proper play because I had to, you know, be that such a quiet person because
Mm-hmm.
I knew that if I tried to socialize and didn't just follow them quietly,
Yep.
that they would pick on me
Okay.
straight away.
Now, what I'm going to do is I'm going to
Whereas with
focus.
my cousin, it was so natural because he's autistic.
Fantastic, and I appreciate that. Diane is hyperintensive episodic memories. That's how she also works. Her communication, her language style, apart from just old language theory, actually is in a lot of stories, isn't it?
Memories.
And that's
Sorry.
cool. No, don't be sorry at all. First of all, I think it's actually really interesting because we can actually get a snapshot of you in that moment. We feel like with you that we're actually sharing that experience because you're so explanative with that. You give so much
I
depth
have
of feeling.
pictures that come that it's like a,
Yeah, she
you
works in
know
pictures.
that I don't know if you're old enough like me, but my pa would always be like, "It's slideshow," and I'm like, "Yay!" I'm sit down,
Ah, yeah.
ready to go before
The holiday pics all on the
before it was even
slideshow on the projector.
wall,
Yeah.
you know. So my uncle Roland would get the projector going
Mhm.
because he was like, I guess, IT dude.
Yes, he
you
was
know,
the technical
he was
guy
the
in the house.
technical guy because he actually works well, he's probably retired now, but he worked in the special forces for the Air Force.
Mm-hmm.
So he,
Intelligence
I'm
section.
so proud of my Uncle Roland,
Mm-hmm.
and I love my Uncle Roland and Auntie Veronica. Like,
not autistic at all.
they are my favourites. They are so autistic,
Yeah.
so cool, and they have cool kids,
Mm-hmm.
and like I just think the world of them. But
Mhm.
yeah, he was in the intelligence for Air Force.
Now, I'm going to bring this back in again. See some of the difficulties that Diane had of staying on task. This is part of her ADHD brain. It goes off on so many tangents. And what happens with the memories, the thought processes, that highly intensive episodic memories, it triggers other pathways that she goes off and explores. Can I?
Look at that.
That is beautiful. I love it myself, but can we put it away for the moment? Because I really want to nail in here. I want to hone in. I want to focus. I know it's difficult. OCD.
Go.
Right. Now, before I actually read this, and the rest of the conversation is going to be around about OCD traits and behaviours. Okay. There is an interplay and there is a crossover, and I'm glad that we've talked about those things. So thank you for doing that. That's really cool.
At least I'm on track.
Yeah, you're listening on track. But what I want you to actually come back into, almost like you're going back into the Harry Potter, into the pensieve, and I want you to grab those thoughts and extract them and put them back into your brain about OCD moments. What do you remember from childhood all the way in your evolution? You're 51 years of age now. I remember you obviously in a clinic, and the psychiatrist actually was very specific. He wanted to stuff your stuff up, because he said you are so routine based. You do exactly this at 8:30. You do this exactly at 9:15. You do this exactly at 10:30. You are straight, rigid, square. You're a square bear.
Yeah, and I wasn't socialising with the others as much.
That could be more of the autistic traits, but yeah.
Yeah. So that was more on that discussion. But I remember as a kid.
And it's okay to feel the feels during memories, because memories can bring back some very triggering, touching points when we reflect, when we're asked to think about and consider. And a lot of time for people with autism or with Diane's experience, it's a time where we go, that shouldn't have happened.
It was very traumatic before I was diagnosed, because I was never in a good situation, and when I had my kids, I was responsible for 2 children, and
2 lives.
On an autistic of my level, that was like not recommended, but the kids were okay, don't worry about that. But
they were always safe, yeah.
I was very underweight, I was stressed all the time, like hyper focused on my children and worried about safety.
Hyper focused, yeah.
And didn't want to sleep, because it's like, oh, was that one of them making a noise? Do I need to get up? Not wanting to have a shower because they might need me. And then like being in public and being picked on if my child, I have an autistic child, if he had a meltdown, or just looking young, because I always look way younger than what I was. So you can imagine if I'm a 20 and 21-year-old mum to both my kids when they were born, that I was picked on, and I go to my car and cry.
So I'm going to talk about probably the 6 or 7 things you just brought up into that little statement.
But as a kid,
hold on, before that, stop.
No,
Pause. I want you to wait. Stress and anxiety. These are conditions that are seen in autism, but particularly in people with 22q. It's actually in the diagnostic criteria, the clinical guidelines for 22q. So you're going to expect to see stress and anxiety. You talked about difficulties with sleep. A lot of autistics struggle with the whole sleep routine, and OCD comes into the behaviours patterning, because you're thinking a lot in repetitive loops before trying to initiate getting into sleep. So there's a difficulty getting that initiating and staying in that deep sleep. And sleep is so important neurologically. It's our part where we rejuvenate, we recuperate, we really feel revigorated and refreshed, but you don't get to have that as you go. You are also focusing on the safety and the patterns and the routines of being there for your kids, and a lot of that also ties into OCD behaviours, because you were being above and beyond just being a parent. You were so routine orientated.
But at the same time, I had support. So my home day carer, where the kids weren't there often, but because I was studying, because I got a late education, which is perfect for an autistic like me. And so I went back later, because I wasn't like the other kids. I wasn't ready when they were ready. Same with driving a car. I wasn't ready when they were ready. I didn't go out to pubs or anywhere with my friends. I didn't do anything age peer appropriate.
Yeah.
So
very autistic.
I basically So my neurology from last night.
That's okay. Take your time to think. I'm not rushing you. One of the other things you did mention was also about you lost a lot of weight. And again, for females with autism, 20 to 25% of them can actually struggle with eating disorders,
it was just,
anorexia.
I just
distraction.
was so anxious. And when I was anxious, I'm still like that now, but I was worse back then. If I was anxious, and I remember as a kid, my mum would be like, "You've got to eat." Like, and I'd pass out. That's how much I would not eat as a child.
Do I tie back into that thing called interoception for autism? Because there's that awareness of internal states. Am I hungry, thirsty? Do I need to go to toilet? You don't have that ability to know.
The doctor is saying, you need to make sure she does this because she's developmentally delayed.
Right.
And see, she obviously thought I was at the age of, like my brother's 2 years older, she can make her own food, get her own drink. I wasn't drinking and eating.
No. So you are born with a condition, first of all, in a NICU, premature, but you've got global developmental delays, failure to thrive, small in stature, small in head size with microcephaly. You then have IDD, intellectual developmental delays, and educational and learning delays all the way through. So you've got all this to contend with, and you're still becoming a parent in later years. That all makes sense.
Because that's a cultural thing. Like in my family, it is, you have to do that. Like me going to education, it was named and shamed.
Exactly.
And told
you're meant to be in the kitchen.
You should be at home with your kids.
Barefoot and pregnant. Sorry, that's the analogy of that culture.
I come from a line of young mums. So my nana was a 17-year-old mum, which is that era, so don't think it's... And they had a beautiful marriage. But my mum got married, had her first child at 19, and I had my first child at 20.
So culturally... that was through the era of the times. That was very much expected.
Well, that was our family culture, not my friends. My friends didn't have to have babies.
One other factor that came into this, and you also mentioned that you appeared and you looked younger, and you were picked on that by people in the street or the peers. I want to point out again, for those who are maybe new to the channel, if you are new, hi, don't forget to subscribe and hit the notification bell. But Diane's got Down loss syndrome, EDS, it's a connective tissue disorder, collagen. In fact, she's got incredibly smooth skin. So all her mum, her grandmum, as you look back, they all look 20 to 30 years younger than the chronological age. It's a smooth skin, small size.
Like people in life out there are going to judge that. And it actually makes me sad because I want everyone to know that it doesn't matter what society tells you you should look like.
Correct.
I know
You're all
that
beautiful
someone
inside.
like me, people keep thinking, and people used to say it to me if I said, "Oh, I feel so fat and bloated." Just one comment like that, if I was in a group of women, I would be absolute attacked, like savage dogs would come for me, and I'd end up sort of like shutting down and then going home and crying in my wardrobe and rocking for about an hour because I didn't understand why they would do that.
So you're overwhelmed with an autistic response.
I want people to know it doesn't matter what you look like. Please, just because someone like me looks the way I do doesn't mean that I go, hey, I'm judging everyone's looks. No. I love people's spirit.
But you also have relatable issues. It doesn't matter.
Most women don't want to be my friend.
But it doesn't matter your weight.
Because they're...
With your condition gastroparesis, your stomach changes in size 4 different dress sizes in a day because you bloat out. Now, it's not, again, in your control.
No, but I'm just
and it's
saying,
natural for you to complain about that.
I don't have friends because of what I look like.
I acknowledge that.
I've never had...
And a lot of that's because of the behaviours, not only because of what you look like, but being autistic, coming in with the things such as OCD, going off in tangents. And look, we're very patient here. Well, I don't care. We might have a theme that we're going to be trying to talk about OCD today. But if we don't get to stick to that, that's okay. No, you don't. You're actually perfectly imperfect. It's perfectly fine to be that. Okay? It's about acceptance. I don't care. There is no agenda saying I have to talk about this subject today. It is an initiating topic for us to have a conversation on. We don't also know what it might elucidate. It might bring up different things. You might go off on different tangents, and they could be absolute gold.
From maths, even though
Married at first sight.
I've talked to you intellectually, but I have to say here, I know that some people are trying to claim that this is all set up and they made it like that. Look,
scripted
sure
producers.
They tried to get some shit stirring. I bet you they did, but I just want to tell you something as a woman. Some of us women cop that our whole lives.
Absolutely.
Women.
Sorry,
from
as a man,
groups
I
of
have
women
seen that, and I've seen
coming
you
like
face that.
savage dogs
Hmm.
and just attacking you over nothing.
Now, if you aren't on or in Australia, MAFS, Married at First Sight, is
It's
a
Australian, sorry.
dating show. It's
But
where they
if you
literally
wanna
meet
watch
for the
it, maybe you
first
could.
time, and they are immediately married without any back history, and then they're put into an experiment run by
It's a social
pseudo
experiment.
psychologists. They're not able
No,
to
no,
be registered
they're
as psychologists.
psychologists, but they're unregistered.
That's why I was saying they're pseudo because they're
they
unregistered.
lost
They are
registration to
relationship
work on the
counselors,
show.
but don't get caught up in the detail around that. The concept is it's been evolving, and we sit there because Diane has studied psychology, and a lot of autistics do actually study psychology. In fact, a lot of autistics also go into nursing and like to help other people.
Yeah.
They're very caring,
That's so
but they also need to
true.
find out about themselves and the world around us, how we interact and how we play. I studied psychology as well for that same reason, because I needed to know how the heck do I function, how do I work, who I am,
What does
and what do I need to do
know
next.
that I don't know?
Exactly. So that's all very normal. But Married at First Sight brings together couples in different situations, and when they come on a couch and they
It's a
talk about
good
their
thing
relationships, and they
because
come together in a social dinner. But that experience was an absolute, we'll call it what it was, a bitch fest, a bullying episode. Nasty girl comes in, Brooke, and
you don't have cameras in
terrible.
real life, guys. So
no,
I remember, like being in a group situation and someone was like playing me because I'm IDD. People always pick it
susceptible
up.
to manipulation. Yeah.
And I was being asked to be in this particular meeting to talk about roles and positions.
Okay.
And we had organised the night before, this one lady and I said, yeah, I'm fine to do it tomorrow morning. I don't want to do it tomorrow morning. And there was a reason, and I gave her the reason of, but so-and-so should really be there, or we should be talking to her first before the meeting.
Involved
It
with
just
that
feels
person.
right.
Okay, sure.
And
Expressive.
I said to her, what do you think? Because that's how I feel. And then she's like, oh, yeah, okay, we'll have the meeting, another day. And that was at 7:30 at night. Then the next morning, and I was happy because I thought it's going to be a better meeting, actually for her too, because if it didn't involve her, because I was trying to fix something that she was being mistreated by someone else, so I was trying to fix that. And so I get there the next morning and I'm helping set up, and everyone was being mean, and I was like, because it was out of the norm, and I just on a speaker, so I said, oh, what's up?
You felt the vibe.
What's the negativity about, guys? Like, what's going on? And that lady I spoke to the night before yelled at me like a savage dog, yelled at me, saying, because I cancelled the meeting, one person drove all the way here and had to go all the way home because there is no meeting. They were only coming for that, and they cancelled their plans. And I'm like, why wouldn't you message everyone
Well, would you communicate
at
in advance?
7:30 last night,
To
which
say not
is
to do
not
that.
unreasonable time, and they do emails and messaging.
Yeah, of course
and
they do. Out of hours.
she knew that person had to be at the meeting because she was going to be doing a position in the setting.
Sure.
So she would have known to contact her,
You're
and she
set
was
up
the
for failure.
current proper staff. I was in a position where I was asked by the president to be the president, and I said it doesn't feel right because this person's worked here longer. I don't feel like I should be the president. So I said, oh, I'm sorry, like you're really upset. And so I'm trying to fix it. And the lady sitting next to me is like, look what you've done. And I kind of got scared.
Well, of course you would be, because that's actually very targeted and intimidating
So I
and
walked
nasty behaviour.
outside and I said, are you okay? Are you okay? Because she was crying. So I thought I need to be compassionate. So I walked outside and I said, what's up? And then she just told me all of her problems. But at the same time, like in amongst that, she said how, oh, everybody likes you and you're so perfect, and And I just said, I'm not. That's not the case.
So her own insecurities are coming out on top of all her other problems
So
that
I
she's
just
carrying.
left after the conversation.
But you
I
left
just
the
left. I
experience, you
never went
learned.
back ever
Right.
again. I just.
Well, I'm not surprised.
And they chased me and chased me and chased me, and I didn't understand why. Because it's like, you don't like me.
No, but they want you. They need you. They want the services that you provide. But they
They
were
were
nasty
all
pasties.
turned on me, and it's like,
And-
I don't hang around people
That's
that
good.
treat me
No,
that
that's
way. I don't go back.
It's a good boundary to
I
actually
don't
put
go
into
back.
place. And it wasn't just one person. You saw that they can manipulate the situation
There was
and
3
launch
other
an
people,
attack
so
at
that's
you.
4
They can
people,
target.
4 people on one.
And that's not a healthy situation, and particularly for an autistic who's done the right sort of steps.
I did
through
I thought I did the
process.
right thing.
Yeah,
I'm
you've
not
communicated,
responsible for.
You've got the assertions.
The meeting was a fast meeting, and she
Right.
shouldn't have said it's definitely going ahead
Okay.
because it did involve me.
Yeah, of course.
Because I had already portrayed.
You're taking on a role.
No, but I already portrayed the other president by letting her know
Mhm.
because I didn't like what the president said about her.
Okay. Honey, this
It was
is
wrong.
this is all politics. So this is a lot of backstabbing female bitchy behavior. A lot of autistics can't manage this because it's dynamic, it's intense. You've got to be able to fight almost in these positions and create dominance.
But then
and
I found out why
Ugh.
later on.
Yeah.
Because she was treasurer, she was stealing money.
Oh shit, man. Okay.
But I didn't know that like the president should have told me that she was maybe suspicious or something.
Right, but
She
then
should've
she was trying to
told me.
protect the situation so
She
it
wanted
wouldn't
me
come
to be
out.
president, obviously for that reason.
See, hindsight's great with 20/20 vision because you do learn a lot when retrospectively you can actually reflect back on the situation and see how all the pieces come together.
And also, I remember texting a friend that stopped being my friend,
Right.
and I was just saying, what's up? Why are you being like this? And she was sitting with another friend that was a new friend of ours
Yep.
together,
Okay.
and yeah, they were just laughing at me when I said, "Why are you bullying me? Why are you being mean?" And
So what you're seeing
they were
is a lot of
laughing at me.
triangulation, a lot of behaviours, which is about manipulation of the situation. You're vulnerable, you're susceptible. You
'Cause
don't
they don't
play
say it.
games.
They don't
You're not
say
aware of what's
outright,
happening. Yeah,
we
you
don't
take
want
it
to be
literally.
your friend anymore.
No, and if they're not saying it directly, you don't know. You take things literally. You put a smile on your face. You're turning up. You're doing all the right actions. But these people are working together to undermine that, and it's obviously a sore point. It's a triggering point, and I think for a lot of autistics, I've been through it. You've been through it too
And
many
then
times.
she put on Facebook, "I want to high five someone with a brick to the face."
Right, so that's actually a very
Towards
aggressive
me.
action.
And then she wrote a post saying, you know, how dare this person try and steal my best friend? And I'm like, we're not children. And number 2, I've known this person for 3 years.
Longer than the person.
And this person's just met her like
Right.
for a few months.
Okay, so first of all, there's aggressive behaviour. In
And
both those scenarios, you had a person next to you
I have
say,
no issue with them being friends.
in the other scenario, you had a person next to you say, "Why'd you do that? Look what you've done," and did a very aggressive behaviour. Here you've got another person doing aggressive, threatening actions, high five you to the face with a brick. It's like very intimidating. It's very like, ooh, and I know you've had a lot of experiences of bullying. I mean, look, what autistic has not experienced bullying in their life, really? Seriously. And I've heard hundreds of stories through almost every evolution of your age group because you're so susceptible to being bullied. And you're right, there's a beauty effect. You come in, you're positive, you're cheerful, you're happy, you try to uplift people, and people tend to want to just drag that down.
Yeah, people
Heck of a
lie
lot.
too.
Thank you for sharing those stories. It doesn't relate totally to the OCD side of things, which is what I was talking about, but it's okay because these are autistic experiences. These are life experiences that sometimes just come out in these conversations. So first of all, if you do relate to, and if you're autistic, if you relate to bullying, let's have a conversation about that in the comments below. First
There's
of all,
so many examples. Like
there are. See, that's what I mean.
sometimes when I look back,
Yeah.
I just don't know how I got through being autistic in this
Did you get
world.
through? Did you get through?
Not well, no.
No. Because I'm going to be honest. I don't think you got through. I notice
I
you're
think
rocking at the
it's-
moment, by the way, too.
I
You're
think it's
self-soothing.
why my kids don't want to be around me because they
Mhm.
think that, you know, they do love me. Don't get me wrong,
Absolutely, they
guys.
love
It's
you.
not. I
100%.
hate
They
them. My
appreciate you being
children are
on them, yeah.
not hateful people. Number 1, that's not how I raise them. And number 2, yes, I know that they love me,
Mhm.
but they're just not understanding that what they're doing is just unnecessary and a waste of time.
Yep.
Because millennials are doing that, okay, right now. It's popular to be a
It
stranger in your
is
family.
hugely.
It's just, they're probably just trying to fit in with
Prevalent
their
in
peers.
society,
And
yeah.
I just understand as a mum, but it's just very difficult because I feel ashamed and haven't had the chance to have that conversation, even though my son did say, you know, like, it's okay, Mum, but I still feel shame that they saw my meltdowns.
Correct. Now, that is also not showing caring, compassion, consideration, accommodations for a condition that is out of your control. If I may for the moment. So you're born with something which you have from the get-go been conditioned and squashed to be not that person. Don't be autistic, don't be ADHD, don't be OCD, don't have Tourette's, don't have seizures, don't drop down on the ground. Okay, it's so fucking frustrating. But this is society in general, and a lot of autistics, I believe, feel this way. Yours is amplified because of also having 22q. A lot of the behaviours and traits, which is your condition, you don't have a choice over. We don't have a choice living in a medical environment having to deal with the complexities of your condition because of who you are and what you've got. You're lucky to be fucking alive. Let's be just honestly real about this. But you get grief from a healthcare system, a disability system, society in general, education system fails you, your parents fail you, you become an orphan because of it, and you're let down by your own children and other friends who have all dropped off along the way. Very common for people who've had complex, long conditions, particularly over 10 years or more, to lose everybody around you, all your informals, your friends, your siblings, your cousins and aunts and uncles. They drop off because you're not the one who can be fun anymore. You can't attend the appointments. You can't participate. You can't be normal. You're being you. You're being your normal, and it's perfectly fine to be that.
My mum would always be, you know, like, shut up.
Yeah,
you know, she always used to say that because
you've been put down
in my family, you know, I would say something and it was obviously weird, and I just am haunted by the looks of my nana and mum because it's like haunted. I always used to sit there going, I'm sorry, in my head.
You're apologising either outwardly or in your head, and you actually do a lot of outward actions to apologise, and you shouldn't do, because again you're being punished for behaviours that are just being you, okay, being perfectly you.
But
and we should embrace
and
love that.
hindsight and go, yeah, no, I was getting all that off topic, or I was not. I was interfering with the
flow of things.
There.
Yeah. But then where's the tolerance? Where's the compassion? Where's the understanding? And this is where, hold on 2 seconds, John. So this is where when early intervention is so important, early diagnosis of conditions is so important because it allows the systems to be able to put into place and implement things to help the person with a disability, and hopefully the structured supports around it, the family, the parents.
Yeah, but it was called
but
retardation.
In your era, you didn't have any of that.
It was called retardation.
Back in the 70s, it was.
All of the parents in Australia, I mean, I wouldn't say all, I guess, but most felt shame. Correct. And we were hidden.
100%. Look, it's not just even back in the 1970s. We're talking with a lovely lady downstairs who's also brought up the Mosman Park incident. Now, this is a familicide. It's the death of a family, 2 parents and their 2 children, 16 and 14, profound autistic children, non-verbal, high support needs.
Well, one was
murder-suicide,
verbal, but he was
again
high care
failed by an
still.
Education system, let down by the NDS, the disability system. But this is the same messaging, and I only reflect upon this because, again, it's not their fault, it's not your fault. You're trying your best every day to rock up, turn up, and cope. We all are. Okay, we struggle in this household. I mean, seriously, I dropped bloody hot chocolate drink over me this morning because I've got no coordination because I'm friggin' tired. We are dealing with sleep deprivation each and every day. We're dealing with intense pain. Pick a symptom or a condition. I mean, seriously, I could be dealing with 5 mixed mode conditions simultaneously in an event, and last night you had another event that went on for about an hour and a half. These things are exhausting. Physically, they cause pain. Today, you're suffering. But again, are they your fault? Should we take that out on you? Should we be blaming you for that or your inabilities? But your mum did. Exactly, and that's the messaging.
Bed. Yeah. You know, why can't you
Eurenisha, bedwetting,
like,
which happens in patients with 22q.
Because I used to sit on my knees to sit on the chair.
Yeah.
At the dining table.
Because you're tiny.
Because I wasn't big enough to reach, so I would have to sort of lean over.
Did they get you a cushion to rise you up? Did they get you another chair to fit you more appropriately? No, they didn't make accommodations, and you're just expected to cope. And that's not on you. That's on the people around you. Remember yesterday I was also telling you about the safety. You were put in. Yeah, great. And there's certain external influences. There might be the uncle over here, or whatever else, who sees this. They see it briefly. They try and make it up for it. They try and uplift you. They try and nurture you a little bit more. But then they have to move away because they're on with their other life or going. It's a fleeting and glimpsing sort of moment. And then you're back to the drudgery of the day-to-day of being told that you're inefficient, you're defective, that you're not good enough, that you're not wanted. That's the consistent repetitive messaging that keeps hammering in. It's disgusting. Okay, it really is. We were talking about safety the other day as well, particularly based on a true crime situation that's happening at the moment in South Australia with the Gus Lamont. It's a little 4-year-old boy, autistic as well. And again, that boy's disappeared. There's a whole thing on an Australian farm and it's playing out. But it brought up the conversation because Diane was brought up in the countryside, and there's so many things, so many stories of her doing behaviours which were just so unsafe.
Yeah.
And it's like, just like the Mary Poppins experience. You know, she sees Mary Poppins, she thinks she can fly. Or she, as a child, thinks she's a super character like Wonder Woman or Superman, I can fly. Well, what does she do? She goes up on top of a roof and jumps off from a very high roof, being a very small person. Lucky you didn't break your neck or anything else. And you did the same thing on a bunk. You jumped and your brother moved something, and again it was very high. You had a lot of injurious behaviour because you just didn't know different. Now you climbed up the side of a water tank. You looked into the water tank and thought, wow, I dropped some things in, I can hear the splash. That's so enticing. Water attracts a lot of autistics and autistic children. This is why so many things happen on farms, just like with the dam situation. You were told, don't go into the dam. The mud can suck you in. You might not be able to get out. Well, you did that. You slipped. You went in there independently by yourself, alone.
I went to get the clay to play with
because
it
it's a sensory
regularly.
thing.
Yeah.
You were seeking
and I
out.
used to take a whole bit in my
Think
bucket,
of the risk.
and I would go away from the dam.
Yep, and you're out of sight. No one can see you.
Sometimes my gumboot would just slip into
Right,
the water.
so you could have
and I
slipped
was
straight in, and you could have got stuck, and you could have drowned. In the water tank, you've climbed all the way up. You've opened the top.
I was gonna
You've
jump
looked
in.
in. You were going to jump in. You
I
did a
thought
Mary
there was
Poppins.
a
You
ladder.
jumped off a roof. There are
Because there
so
was a
many
ladder on the other
stories
side.
of behaviours. I'm thinking, far out. You're lucky to be alive today. Realistically, let
You know
alone all
what
the
stopped me from
assaults and
jumping?
attacks and everything else that's happened later
The
on in life.
jumping in, it's because it was
Yeah.
dark.
Right, so the darkness.
The darkness
Lucky.
I'm scared of.
Okay, but you can
Still.
see you didn't have the oversight. Okay, the overwatch.
And I
No
nearly drowned
helicopter.
it
No
too.
helicopter parent going,
And I nearly
hey.
drowned it too
Yeah,
in
if
my
you-
grandparents' pool because they had like a massive house. It was very big.
So
And
lucky.
I don't know, there is many ways I could have snuck out, I can see. So I can see
Autistics
why
are
it would have
attracted to
happened.
water,
And
by
in
the way,
those
a lot of the
days,
time.
there was no fencing
No pool fencing rules.
obligations. This is like
No.
the 70s,
No.
okay? So, but yeah.
So
I
little
survived
Winston, the
because
sausage dog, would have been barking his
he
head off
was-
saying, warning, warning.
I know, like Pa used to say, you know, like, it's okay, he's just stressed because of you. Whenever you get in the water, like, I traumatized that dog.
No, you've conditioned the dog to actually have concern.
And I used to
dogs
tease
are our
him. I
best
used to
friend.
put my foot in and he'd bark. I'd take my foot out and
You're
he'd
just
stop
playing.
barking.
Yeah, you're just playing with him. But he's
I
actually very
loved
close
him.
to you. And he
Like,
loved you.
this was what Winston was like.
And that's a replication of
sausage dog.
Winston sausage dog. Okay, so we've covered a lot of things in this conversation. I'm still going to wrap back around, and I'm actually going to ask you to park any more on that. I acknowledge what you've been through.
Can I have a break?
Yes, you can.
That?
I think you need to have a toilet break. Frushimite is here. Toilet breaks are over.
Mm.
Frushimite, unfortunately, as a loop diuretic, will certainly make you want to go wee wee wee
And very-
35 times all the way home.
I'm very slow.
I know we need to get that out of you. I want to point out that, look, this is very insightful and it's actually very useful to share these experiences because we learn from the experiences, whether we don't have an autistic in our own family or whether we are a parent or a person going through this. It's actually interesting to relate and to know what to look out for and what the
Yeah.
experiences happen to be. Look, as an educator, I've seen thousands and thousands of children, and autistics do stand out, and they are different from the rest of the herd. Okay, and a lot of the experiences that Diane is not saying this is just normal childhood. This is an incredibly higher level, and there's so many higher risks. Absconding is quite a common sort of behaviour. Not understanding instructions and being able to follow those through, particularly with executive functioning, occurs quite a lot of the time. You point out things such as interception and alexithymia. These sort of behaviours happen a lot of the time as well. But just the actions, the risk, attraction to
Because my
water,
family would laugh at
sensory seeking
everything
type
that
things.
I did that
Oh
was
my God!
autistic.
And my point
It
overall
was funny to them.
with that was, if
She's just quit.
they needed to be educated, they're the ones that needed to have the support and assistance from the government to actually be educated about, you've got a child that's different, they've got
No, but
learning
they
different
refused
abilities.
that. Like,
Bingo, but that's what they needed.
My family are
but they didn't.
affluent guys,
Yeah.
and affluent families it's shameful
Yeah.
for your child to be special needs.
Exactly.
So
They want to
what
tuck you
they
away in the
did
back room
was,
and never be seen.
I remember my mum lying to the doctors, making out like she's fine. Even my asthma spray was chucked away when I was 12. But basically, you know, I knew that I wasn't okay, even as a child, because I'm going through it. Every day was an absolute exhausting
You're living it.
hardship. But she was being told, like, we want to do all these things with your daughter, and she would always be, and the schools, and she didn't want to hear it. And
She
now
didn't
I
take
get
them
why.
towards
It's
and to get you help.
shame.
Yeah.
She thinks that autism,
Should be able to be beaten out of the
unless
kid.
they're non-verbal, but she thinks that autism, that might even just speak even a little bit, is bad parenting, and the bad behaviors or the bad things they might say is all bad parenting.
So this is the result of that era, lack of information,
bad
knowledge,
parenting, shame.
understanding and communication. Look, it's only last year, 2025, that the Australian government has actually written out a guideline for autism to try and actually
And
engage
I'm
with
now on,
autistic
like,
groups
two-
and educators and
I'm on
advocates
2
to
registers,
try and
so
improve
they know.
the interaction, whether it's in the workplace, in
Well,
education,
they've got
in
it
medical,
written down
etc.
under the police
100%.
and under the government.
Yep.
Now I'm registered, because you know why?
Mhm.
I actually did do something where I intervened in a lady getting arrested,
Yep.
and it was a wrongful arrest. Luckily though, what if it wasn't?
Correct.
But I just felt it was the right thing to do. And when you're autistic, you don't
You're very
see
rules
authority.
orientated.
It's
Yeah.
just, no, I don't care if you're a cop. This is wrong. I can tell it's wrong. A, B, C. And because of my learnings in social welfare, I do know the rules.
Now, autism doesn't just stop at 18 and suddenly dissipate, go away. Okay? And in fact, for some, it can actually get worse. You might build up a toolbox, you might become more
Well, I
functional,
regress with seizures, so
but
you can
neurologically,
regress as well.
you can also go
If you're
backwards.
elderly.
Your peers can continue to go up that way. You can just plateau and sometimes decline. And that's why you can also be left behind amongst all that. I want to swing back around to OCD in the article. I'm just going to read some of these things as we wrap this up, because I want to point out some of the OCD specific behaviors. We see this. Sorry?
I failed this video again.
No. I actually think they're content gem, because these are insights that a lot of people don't get to understand.
I'm
Realistically,
haunted sometimes
yeah.
with the situations, but you
So
know,
I'm happy for
I
you to
used
share
to
these things.
cry
I
a lot.
appreciate that. And I know it's
alone,
emotive,
I used to cry
Yeah.
a lot.
but it helps paint the picture.
I was ashamed.
What has this
to-
person come
But I was
through?
ashamed, like I had my home daycare and your mum
Mhm.
always keeping an eye on me, because they knew. They might not have had the name, but they knew.
Yep.
And I'd lie to them and say I'm okay.
Yeah.
Because they were so nice. They didn't want to always ask for
Mm.
help, but I needed help. And they did give me help, but I'm
Yeah.
just saying I should have asked for it the whole time.
If you have a person with autism in your life, you know, as a child, as a partner, as a friend, as a neighbor, just remember they might not ask for help. OCD. Now, there's a lot of OCD behaviors, obsessive compulsive disorders. There's different types. You are organized OCD, but you also have repetitive
And
behaviors.
germaphobe.
You're also cleanliness based.
Yeah, like sometimes I can't press a
OCD.
button on the lift, or
Yeah, your
I can't
repetition
do
of
it.
pattern, and the repetition of pattern is commonly seen a lot around your Tourette's as well. So you'll do things in 3 groups.
So
It's
as a
clusters
kid,
of
what I
threes.
did was, and when the lights were on in Australia on our switches, there's a little red dot.
Yes, the dot.
And I didn't like the red dot. Hate the colour red. So I'd turn off all the lights.
Now there's a logic. Now we understand that it's the red dot specifically that made you want to turn
because
off the lights
it goes
all the
away
time.
when
It
you
goes
turn the
away.
light off. But then everyone's like, why
Can't
are you
see.
turning the light off? My mum's cooking dinner and she's like, what? And then, you know, the bedrooms would normally, the lights would be left on, because in those days houses were bigger, right? In Australia, they were bigger. And so the other end of the house would be very like,
Can I?
and so I was so scared of the dark, even when I went to the toilet, I had to turn it off because I had to get the red dot, that I'd turn it off and run to the lounge room to feel safe.
This is why we have these conversations. To dig in deep, to go inside the mind and hear the why. I would like you at some stage, one of the channels that you follow on YouTube and we've been following for many years, is Fathering Autism. the Mass family.
Yeah, because
in
I
the
like
States.
Abigail
Mass, who's now 20,
She's 20 now. She's
is
a woman.
a person with
She's a
autism.
good advocate.
She also has a lot of OCD behaviours.
Yes.
And she's non-verbal. But
she turns off lights.
Thank you. The key point
I
that I want to...
she does though.
Okay. I'd like
she
you
might have a
to message the
On their
family
channel.
on their channel, because
Yeah, I
you can give an
should tell
insight
Ace
in
and
my
Priscilla.
experience. This is why I did that. Now that could be a simple thing from an ABA therapy perspective to go,
But what
you know
if
what?
they don't have the red dot?
Maybe not.
Or
Maybe it's
maybe the
because
shape.
it's the shape. She likes
Could
it
be
to be
the
in the down
shape.
position rather than the up position.
Yeah.
It could be the fact of just changing the light switch to a different type of light switch feature. That's suddenly that OCD activity, which is a regular, consistent, and they're always turning the lights off while they're cooking.
Yeah.
But see how you've just drawn that
Well, my
conclusion?
mum was always in the kitchen
You've
cooking,
been watching
like
that show for
Priscilla.
10
She
years.
was always in the kitchen for hours.
You've been watching the
cooking.
show for 10 years. You've got the behaviour yourself. You're only just piecing it together now by looking at that insight. All right, let's keep talking about the OCD and let's see what else we learn.
Let us know if you turn lights
It's
off.
often misunderstood. Elena, who's this article's about, written by Tessa Fleming for Haywire, wants you to know more about it. So one of the first rituals Elena felt comfortable sharing with her doctor was the way she held her toothbrush. It was a very specific manner in which she would place her fingers up the back of the brush and then slide them off. It was the same motion every time she brushed her teeth. If it was wrong,
I do everything the same.
if it was wrong, she would repeat it over and over to make sure it's done correctly. In pull quotes, it says, it does slow you down in the mornings when it doesn't feel right, and if you've done it 7 times, she says. So the toothbrush handling would later become known as one of Elena's ritualistic OCD behaviours. It's called compulsions. Repetitive, time-consuming actions performed to temporarily reduce the anxiety of obsessive thoughts. Here's an example. I bring you the laptop every day so that you can do the budget. You're great at doing the budget. One of the actions that Diane does repetitively will be pressing the save button. That tells you that the program is saved and she can safely close it down.
I didn't know I did that.
How many times do you press the save
I
button?
have to be sure.
To be sure. Now, we say these things with a laugh.
So if
but-
I do it and then, okay, I do it more than normal, I am aware of that, but at least I know it's saved.
Okay.
Because it
But
has
that
to,
is
that's very important.
Repetitive.
And I feel like less
time-consuming,
anxiety after I've
ritualistic.
saved it to that many times.
Right. And that's why you do it. Because you want to be
But
sure
at the shower,
it reduces your
I
anxiety.
clean myself 3 times.
Yes, you do. Things quite commonly will happen in 3s. It's the pattern. But the funny thing is,
It's
you hate
exhausting.
odds. You like to be even. You don't like odd
No,
things.
but I do
But
think
3
in
is an odd
threes.
number. Make it make sense. Now, for Elena, who's 18, often these obsessive thoughts revolve around a sense of impending doom or the feeling that spiritual disaster could follow if the compulsions are not performed correctly. A bit like you walking on those
Yeah, I thought
pavement
that something
slabs.
bad would
If
happen
you
to
step
my
on the
mum and
crack,
brother.
oh my God, what's going to happen?
Yeah, I
You
thought
know?
something bad would happen to my mum and brother.
Right, and that gets in your mind, and it's like, I have to do this, and if I don't, oh my God, if I fail
Well,
that,
they were my familiar
it's
people.
dread.
And to people that go, why do you talk about your mum when she abused you? I want to tell you something as a child welfare trained person. Abused children love their parents. Please get yourself educated on the reality of an abused child.
Correct.
They love, genuinely, we love our mums and dads. We do not love what they did to
The
us,
behaviour,
of course.
no.
But it is instinctual.
So also
Please understand that and stop shaming people like me for, well, you might think I'm, lying, or you might think that I'm being deceptive, but you might think that I'm, I don't know, like, that's ridiculous. You have no self-respect. It's like, no, stop that.
No.
It is instinct.
and it's actually also important
Like, look
to
it
have
up.
those conversations, because you shouldn't be left alone with
Because
it.
that was my familiar
It's a
person
family
for such a
community
long time.
problem. It's not your problem alone to have to deal with.
I wouldn't have survived without
Okay.
my mother. Even though she abused me, I wouldn't be alive if my mother didn't keep me alive.
Mhm. Now, do you know how many Australians have OCD?
No.
Well, OCD, Obsessive-Compulsive Disorder, affects about 3% of Australians each year, but its nature is often misunderstood. Diagnosis can take on average 9 to 10 years, says Lara Farrell. That's
Well,
common,
that's bad though.
but
9 to 10 years is too long to wait.
Right. But in the 7,000 rare conditions that exist, all of those take on average 8 to 10 years to get a diagnosis. Now, that's just the first step, getting the diagnosis. What happens afterwards doesn't also go very well. Only 5% out of those 7,000 rare conditions have actually got any treatment or management plan in place. That means 95% of rare conditions, which affect over 2 million Australians, by the way, 8% of the Australian population, don't have any support processes, healthcare options to actually treat their symptoms and their conditions to stabilise them or get them better. So that's very concerning. So it's no surprise to me when we say that it takes 9 years or 10 years to get a diagnosis. Now, Lara is a clinical psychologist, and she's also the director of the Centre of Mental Health at Griffin University. We know a bit about Griffin University.
Yeah.
The reasons are quite complex. People with OCD can be adept at hiding symptoms, and often the conditions appear alongside other anxiety disorders or depression. It can get masked amongst things like autism, the Tourette's, you can be lost amongst as well, even if you just got anxiety. And remember, your condition 22q comes with fear and anxiety. As well as autism has anxiety as part of its mainstay of baseline conditions as well. So the person could be diagnosed, oh, you've got autism, but did you also be aware that they might have OCD? Or they might be doing ticking type behaviour. So they might have a tic disorder or Tourette's.
Sometimes it's good to have these conversations, because I had a conversation with my new neighbour, because we were both disabled, and I said, oh, with my condition 22q, I have fear and anxiety. So that's why I think this, in this situation, I get anxious. And it's good to share, because there's so many people out there suffering different things and they haven't got a diagnosis.
And a bit like...
Or they have a struggle because of being maybe an undiagnosed autistic.
Bingo. And I was going to say that, a bit like the person that you met in the pool.
I believe they're undiagnosed autistic.
I would say the same thing too.
Amazing person.
And you see the traits. And look, we've both studied the DSM, the Diagnostic Statistical Manual. You've been a focus in psychology as a special interest. Exactly. And you went to university to study psychology.
To learn DSM.
So, and we've dealt with a lot of people with autism on all areas of the spectrum, and as well as being both autistic ourselves and being parents of neurodiverse children, 100%. So we've got a bit of insight to be able to make an opinion, an informed opinion based on those behaviours. Now, a person with OCD can also avoid diagnosis due to stigma, Professor Farrell says.
I was cheeky too.
And you also deal with stigma, and you also mask things from being told off. You don't want to have something, sometimes a condition, which makes you feel less than in society, judged by your peers or other people.
Well, I still am amazed that everyone here is nice to me. No, of course they'd be nice to me. We're all like a kind of a family here, because
it's a lovely community.
We've been here since the beginning like them, even though we went away and came back again. And there's a lot of just genuine kindness between all. And I couldn't suppress the tics. And as we left, and I wasn't drinking, guys, they were, but I'm not allowed to drink with my heart. So, as we were leaving, and I was like, we've got to get to the lift quick. But the guys were fiddling with the drains to show someone about the drains, how to lift it and how to put it back down. We're just a great community anyway. So I knew that what they were doing, but I was like, well, it's not in time. It's not in time. But I just went, bye, guys.
Right, so the suppression could no longer be contained.
But it did add well to the conversation, but it's not something I wanted to do.
It's not a behaviour you want to do.
It was a tick that was like, don't do it, and it was just like...
Right, now, when you talk about tics and Tourette's, Tourette's is a tic disorder, but it's a combination of both motor and vocal tics. And you need to have it longer than a year. Normally, it needs to be diagnosed as from childhood.
I had it as a kid.
You've had it as a kid.
I used to get into
with
a lot
that,
of trouble.
8 to 10% of people with Tourette's can have this, the coprolalia, inappropriate speaking, swearing and language, or copraxia, the inappropriate flipping the bird. That's uncontrollable, just as much as a motor tic like that,
or my brother, how do you control it? How do you not do this?
And that uncontrolled still comes back to the same brain parts that are also affecting the OCD, and that's why we're letting this part of the conversation kick in. But I'm very mindful of time, so I'm going to rush through the rest of this part. But there's a direct correlation. Just as much as you can't control a sudden motor tic action, or you can't control you doing that action, it's no surprise that you can't control the OCD. You can learn through cognitive behavioural
I just
therapy,
do it.
different
Sometimes
things.
I just do it in front of people.
Yeah.
I don't care because I am so
Sick of suppressing.
no, just I can't. It's just too uncomfortable. It's like no, forget it. My
Right.
comfort as an autistic, my comfort's coming first.
Right.
So I'm
Okay.
just gonna do it. Don't care.
But and I know you say
You know,
I know you
because you
say
just-
you don't care, but the flip side
No,
is you're immediately embarrassed.
The Tourette's is I'm
disappointed.
talking about the OCD.
OCD, yeah.
OCD, I don't care doing it in front of others.
But the Tourette's, yes.
People will point it out sometimes if they're that kind of person to not just think it but say it. I just don't care anymore because it's
Okay.
like I don't care. I want to feel comfortable.
Good, and you need to.
I know it's
Society needs to accept.
irrational, but I don't care.
100%. Now, there was a nice gentleman who's working at Woolworth Shopping Centre up at our local thing,
I like him.
who I pointed out when I first went through. I noticed that he had
Suppressing
Tourette's,
his
and he's
Tourette's.
suppressing his
And he
Tourette's.
just makes occasional noises.
Yeah.
I love him.
He's non-verbal.
He's
He
so
can't
cool.
speak, but he is actually working on a checkout.
He's
But I
good
let
at it.
Diane know before we went through because, again, I didn't want it to shock her and I didn't want her to do a faux pas, but so that she's aware in advance so that she knew how to interact
I
and how
just
to
talked
engage.
to him and he likes
He loved it. Absolutely. Big thumbs up there because that's the way he was able to communicate.
He's my people.
Coming back to this article, and we're talking about embarrassment. Unfortunately, for some people, unlike yourself there, you get embarrassed about the Tourette's. Some people get embarrassed
when I
about the
was young-
OCD
Yeah,
behaviours.
when I was young, I
Often,
did.
there's an awful lot of embarrassment or shame around symptoms that are really distressing.
When I was young,
Obsessions
I
that people feel
that.
really uncomfortable telling others that they might be
Mhm.
experiencing, she says. For Alina, the disorder was triggered at
Absolutely.
12. Now, hers was triggered from a traumatic event. Embarrassment and grief kept her from fully explaining the symptoms that were going on, and it actually led to initial misdiagnosis. And how often is that? And particularly
That's
for females.
you're a woman.
Oh my
yeah.
goodness me! Male misogyny in the healthcare system
That's
obviously
what
leads to that.
That's what I said to this lady I met who's actually a nurse
Yep.
when she was working, and like she was so interesting to talk to, and like you know the so what was the thing you just said?
Embarrassment or misdiagnosis.
Yeah, like you know I was talking about that with my physical health. I said that you know I've got this genetic syndrome, and I was explaining to her my disability and you know how it was late diagnosed.
Yep.
And how but before that there was all these things done, but I was just anxious when I'd say as an adult to the doctors, you know, this is hurting, that's hurting, this is my symptoms, that's my symptoms, and they'd say you're just anxious. And she's like, yeah, I get it. Like she's probably seen it in the system.
I think
So-
a lot of females have heard
yeah,
the
it's so common,
gaslighting
guys,
that's put
and
down.
it needs to change because
Of course
I
it
was
does.
diagnosed at 48.
Especially with
and
conditions like
shame
PCOS,
on
endometriosis.
you, West Australian health system.
So many
That's
conditions
a genuine
that you're dealing
fuck
with.
you, West Australian health system.
Now, Alana's got a lovely GP, but even she had, and though she's got a lot of trust in her, she was still finding it difficult for her to talk about the condition, she says.
that happens when you're young. I
Absolutely.
was the same.
And
You
that's
just
where
wanna
you
fit
need
in
the people around
autistically,
you to
wanna
help you
fit in,
navigate.
you hide your autism,
Now,
you hide your OCD.
If she's got a good parent who should hopefully be coming along, maybe that helps bridge it. And this is why patients like Diane has to have, and it's in the international clinical guidelines for 22Q, needs to have a guardian in place for the transition from
18,
child and adolescent
yeah.
into adulthood
So you're
to
my
be able to
guardian.
navigate. So we can come along because I've been to some health appointments with you, and you know when a doctor says, "How are you?" and you go, "Oh, I'm okay, thanks," and I'm going, "No, you're not." It's bridging that
yeah, like
conversation
you've been through this,
and going
this,
through the
this,
clinical
this.
information, the
But I only
symptoms.
say one thing because I just saw the pattern. The doctor wants to know one thing, but for me, being a genetic syndrome, guys, 24
you
specialists
can't
needed.
you can't contain it to
Of
one.
course, I can't keep it down to just saying one thing, but that's why they can't manage me, is because I'm medically
Exactly.
complex.
Now, Elena struggled to tell anyone in the full story, even the psychologist. It was you can't ask that episode on lived experience that eventually named what Elena has been feeling. So she's obviously seen a TV show or a YouTube channel or something along that, and she goes, "Oh, I relate. That's like me." And a lot of people do actually find out about their diagnosis, perhaps through even our channel, by watching and going, "Hey, I see common patterns. Some of the
Yeah.
things you talk about are so relatable. I
Definitely
do that
seek
as
a
well."
diagnosis because you deserve the recognition of what your struggle is.
Well, the first thing it really helps is it actually gives you a name. Okay, like you were given something like 56 separate different diagnoses.
Well, I see it as symptoms of 22,
Bingo.
but they give them all individual names. And look, I get why, because there's crossover.
Correct.
Some people have another condition that overlaps with mine, and
Exactly.
it's all interlinked.
They could just have
It's
autism by itself as an example, or they could just have Tourette's by itself as an example.
Oh, what, the genetics
You've
person.
got this.
What about the
this,
genetics
this,
counsellor?
this,
I
this.
said, so if I didn't have 22q, I wouldn't be autistic. He said, no, looking at your DNA,
Yeah.
I had one side of the family, it was autism.
All the genes that have been
red on both
identified
sides.
tied
It's like,
into autism, absolutely.
Red, that's like...
Exactly. Now, OCD is
green,
often the
not
punchline
amber.
to a joke about an overly clean or fussy person. Oh, look, we're all a little bit OCD. Well, no, actually, I am OCD. And it's actually very frustrating when things aren't right. And for both of us, maybe that works well together. Maybe we would have been a bad match if I was a messy person, because you would have been distressed all the time because things weren't organised. What's wrong?
Like, my friends would say, you know, like, I don't clean my house. Like, your house is, you know, always so perfect, you know, like, it was just kind of turns into, I don't clean my house because I actually have a life.
Yeah.
But I enjoyed
You enjoyed it.
and I take pride because in my family also it was a cultural thing.
Mm-hmm.
You are a woman and your man's providing, and that's what I had experienced. I was being provided
Traditional
for.
wife
So I
approach, yeah.
happily did my part, which is cleaning the house, because I don't want to live in a
Sure.
crappy, dirty house.
But it's also about what makes you feel good. Now,
But
if it's
it
important
wasn't-
to you,
but it was
that's important.
over the top in certain areas, as in
Good to
I
understand
would
and recognise
clean
that.
a clean house, guys, and that
Yes.
not the normal bit. So
No.
there's two things here. Yes, there's a cultural thing of cleanliness is next to godliness. That was
good
my
saying.
teachings with our
Mhm.
bodies, with our environment. It was not socially acceptable to be dirty. It just wasn't.
Mhm.
And that's fine. And I raised my kids the same, actually. But it did go too far in the sense of I would do certain things that was over the top.
100%. And I still find it difficult to maybe rein that in for you or redirect
Still?
you. Oh, even
I
still.
thought I got so much.
You have, and don't get me wrong, you have got 1,000 times better. But I think
used to be bad.
neurologically,
When I was 18, it
because
was
of the mixed
bad.
mode neurology that's going on, and there is a regression across many different symptoms. Your autism
And
has
also you get more
regressed.
coping skills
Your
as you get
Tourette's
older.
has become exacerbated. I think your OCD has also become a little bit more heightened.
Yeah, but you do
amongst
get
all of
better
this.
skills at
You
managing
do. Your
it as you
toolbox
get older.
increases.
So
Absolutely.
you young ones just don't hang in there. It does.
Mm-hmm.
You won't go away, but you will get better,
Coping
like
with
better
it all.
attitude towards it. Like you won't feel so much shame or embarrassment, and you'll get more like skills.
And
to
to be
handle
honest,
it, that
the people around
your
you
type of
also
skills. We're all
learn.
different, have different ways of coping.
We have accommodated by adjusting our routines and our
Well,
behaviours.
you don't.
to
You
suit
don't
both of
tell
us.
me like, don't do that way, don't do. Whereas if I have carers, that's what happens. Oh, you don't do it that way. You need to do it this way, and it's just like I know that's the most common way in the world, but I don't care.
But is
And
it
now
your
you've
way?
just upset me because
And
this
that's the
is
result.
now I have to do it again, but I can't do it again because you're here.
So that's why carers need to be trained
So annoying.
about your condition and
It's like
your
you just ruined
needs.
it all in 2 seconds.
The difference
2
or
seconds,
the
you
impact,
just ruined it.
what they could say. Now, one of the greatest misconceptions is that a lot of people experience some OCD, Professor Farrell says.
Especially when they give
A
me
common
lunch.
term of
It's not
phrase-
the same way how you give me. I get really upset.
I'm so sorry. I'm not laughing at you. It's just like, I'm trying to get through this and it's so difficult for you. We're getting there. But you're right. Again, it's another thing. It ties into your OCD because you haven't been presented lunch in a certain way. It may be the sequencing of the salad. If the cheese is too much
It's
or
got to be
too
for
little.
certain up the bowl.
I use the term
level.
Goldilocks. It's got to be just right, not too little, not
And
too
then
much.
they watch me, and it's like don't, because I know it's a
Sorry.
ritual. How I do everything is step by step by step, and it's the same steps in the same order.
Yep.
And if it goes in a different order, I go, hey,
Oh no.
what hasn't been done. I need to
Yep.
need to do an analysis. This was done. This wasn't done. Now
Yep.
what am I going to do? But they judge.
They judge. Now, a common term or
We
phrase.
listen, then we don't judge.
Thank
Let's
you.
do that, guys.
Professor Farrell says a common term of phrase is, that's just my OCD, or I'm so OCD at times. Now, clinical OCD is actually very different from the healthy rituals that people might engage in out of choice, and preference, get those eyes down,
I'm shutting
or
up.
a drive for having things orderly or
I'm
clean all the
shutting
time.
up.
That's okay, I don't mind you doing this at all. I
No,
can see
I
this.
am trying.
I know you're trying.
I
It's
can't
okay.
breathe in there.
That's what I'm telling you, don't do that. So clinical OCD is very different from the people
Oh.
go, I'm a little bit this. Some people say, I'm a little bit autistic too. It's like, really?
I hate
You got my
that.
problems? Seriously?
I hate that.
I don't think so. And I know, for
It's
those who have actually
so
been through these conditions and
insulting.
really dealing with it, it is insulting.
Because, you know,
You're talking
the
about
autistic
traits.
experience
It's one
is
for
in
spectrum.
the head. You
Sure.
can't say.
You've got some of those traits. Fantastic. But you're not that. Okay? You can deviate. You can stop those behaviors. It doesn't
imagine
stress
being-
you out.
Also, imagine being sick and someone going, you're not sick. You just want to, like, smash him in the face. Not, like, in your head, guys. No, I'm not saying
Yeah.
in real life. Please, I do not incite violence at all.
Never.
But, yeah.
So, OCD symptoms disrupt a person's day-to-day life and cause an enormous amount of struggle
Okay, don't show
individually
me that picture.
and
That's so
amongst
annoying.
families. Sorry, what?
I can't fix it.
Is that picture annoying you?
Can't fix
What's
it.
happening with that picture?
How do you fix that?
Is there something wrong with that picture? Yes, there damn well is. Why would you do that? First of all, why would you have red pens? I hate the colour red, is the first thing she's going to say. Why should red go at the beginning? Why is that pen sticking out? How hard is it? Why is not all the white...
Where's the
Why
black
can you not put the
pens?
caps on all equally and have
Where's the
all the
black
white
pens?
up exactly in the same position?
Where's the black pens?
What is... Oh my God, what is wrong with these people?
Where's the black pens?
Anyway, at Alana's worst, when depression and OCD were feeding into each other, she would be up all night, tapping her feet on the stairs. Yeah, that sounds like me. It would be like 12:30 or 1 o'clock in the morning. My parents were asleep and I'm still at the bottom of the steps, she recalls. And I'm in tears, doing it over and over and over again.
Oh my God.
No. I'm trying not to trigger you. Why? Why?
In my house, we had a very long staircase and then it turns
Yep.
and it goes down. And I only was allowed to walk on every second step. And so many times because of that, especially at night when I'd go to get my snacks, you know, like as a teenager, you want to get your late night snacks. This was as a teenager. And we moved into, my mum and stepdad built that house. I think I was like,
Keep to the theme.
yeah, a teenager. So basically, young teenager. And I would go down to get a snack and I'd be super hungry because normally I'd been practicing dance or because that was my hyper focus. And so I had to rehearse, condition. But I'd go downstairs
OCD.
for food and drink and I'd run down
Yep.
on every second step
Self-imposed. I
And
have to
I'd
do every
fall.
second step.
and I'd roll and I'd hit my back against the wall in the little square bit
Yeah.
before the last 3 steps.
Yeah.
And my mum and stepdad's bedroom was right
Yeah.
there, like near the stairs.
That hit the thumb.
So the door would be open because our bedrooms were upstairs. And it was like, they'd be like, are you okay? And I'm like, yeah. And of course it hurt, but
Shake
it's
it off.
because I could only step when I walked up and
Self-imposed
down the
alternative
steps. Was
steps.
every second step was only allowed.
See the issue?
So
Now, for Lana, it's not something as simple as colour coordinating pens. For her in year 7, it was one of the worst things I've experienced in my entire life. So, about improving detection across Australia, Professor Farrell, a psychologist, believes that better training can improve OCD detection across Australia. I absolutely agree.
needs to get
That goes
better.
across all rare conditions. We need to increase the visibility, having conversations like we're doing today. Our channel is about creating awareness and improving the education around the topic. So do this today. Help us by sharing. Share this video right now to someone, a friend, a family member, someone that you
There's
know
so many
who might benefit from
undiagnosed
having this
autistics,
conversation.
OCD,
Give us a like because it helps us
ADHD.
to be seen in the algorithm. Add a comment, even if it's just a love heart, or saying, I get you, or I feel for you. I don't care what it is, but leave a comment because again, it helps our algorithm and hype the channel. That helps us to be seen more so amongst the algorithm as a small content provider. We want to get the message out because Diane has got such incredible experiences to share. And with her training of being a parent, having children in the same thing on the spectrum, being a person who's gone to university and studied psychology and understands what the doctrination of the education system is and how it applies, and how many females have been missed, and then having a
And
rare
you know
genetic
what?
condition, she's
It-
got a lot of lived
It
experience.
is like something that now I'm proud of because when I look at, because I sometimes, with my psychology online, I'll see forensic psychology like cases and I see people who I know are IED, undiagnosed IED, autistic, maybe OCD and a few other things, and I know that their kids have ended up, or them have ended up in serious bad situations. I'm lucky, I feel, that I had you, your mum, your dad,
Yeah.
your sister.
My mum was a nurse, very kind, considerate,
There's a
understanding
lot of
person.
people in my life that stepped in, a few friends along the way.
She was your pseudo
that
mum,
protected me,
Yeah.
were like my guides, my carers.
Your guardians.
That, you know, in my era, because of my age, it was done in society in a natural way. That's why I actually don't like this caregivers and support workers. It's sad because in the old days when I was young, someone would do it so subtly, there was no label, so it was naturally done.
Now look, and if they're also educated and trained, those caregivers can actually be a huge improvement and a support and assistance.
Like,
but a lot of them,
your mum did. She would
a
say,
lot of us carers
I can't eat all of this, so
educated.
you finish it for me. And she knew I'd do it because I respected her and didn't want to disrespect her by not eating it, because she knew I wasn't eating enough food.
So, assessment needs to focus on normalising symptoms.
I don't know where I'd be if your mum wasn't there.
Yeah. Sorry. From March 1st, she'll be part of a nationwide trial offering web-based training for parents treating OCD at home, with a focus on exposure and response prevention therapy. So ERP is the acronym that they use, a bit like CBT, cognitive behavioural therapy. They use ERP. ERP is exposure and response prevention therapy, where people with OCD are confronted with their fears in a safe environment. It yields good outcomes, and recovery for the majority of OCD patients is there. It's not a catch-all, doesn't work for everybody, and sometimes people with autism can be a little bit more difficult with those sort of behaviours of training cognitively. So not all types of psychological therapies and interventions work with people with autism. Just going to point that out as well. There is a reputation that persistent OCD is untreatable. Well, no, there is actually options that are available to work through, and just having support and understanding is a great starting point.
Skills, because you can't get rid of it, but you can have skills that will help you get through. Because I've learned a lot.
Absolutely, and
just
look,
along the way.
I think it's really important that we do a better job.
Everyone has different. I do want to say in psychology, don't do these psychology courses and go, why am I not doing better? You might have a unique one. I think psychology is just too one-sided. No, too one-eyed with the direction.
Narrow focus.
It's just narrow focus on one thing. Your coping mechanisms for this are all going to be different, all of you.
Great.
Like, mine might not work for you,
and it
yours
depends
might
on
not
your
work for me.
culture, your conditioning effect, how you've been
How you have to
nature,
live.
nurture, the
if
whole
I was at a
influence,
workplace, like if I didn't get sick physically,
Yep.
I'd be in a supported work environment in Australia. They have for autistics a supported job situation, and that's what I would be in now. And
I'm going to point out with that.
I would still be probably trying to mask.
Because you would be, because you're autistic.
I don't have OCD, pretend
But
I don't have autism.
what I'm going to point out is, over the years of seeing you try, and remember that about 75 to 80% of people with autism fail at sustaining long-term work, particularly more than 6 months duration. With Diane, and it's been interesting with the different times and things that she's worked along the way, it's actually been the OCD traits and behaviours that have always been highly praised, wanted, looked for, and acknowledged and rewarded. Every one of those things is actually a godsend. So I want to actually come out of this conversation saying it's not a negative, it's not a bad thing. It's not, what's that foot doing? Tapping away over there. It's actually a power, it's a strength, it's a superpower. And if we can tap into superpowers and actually acknowledge that they exist, and that, you know, people can be different, autistics can be different, quirky,
OCD,
interesting.
I would have been
They are really cool things.
Maybe because I remember like just learning the registers was really, really hard for me, and I had this little job that the OCD really, I just did it for money, because here I am, like, been to university, I'm qualified in so many things, but being an autistic, I couldn't cope in those environments anymore, because everyone, like, the older I got, the harder it gets, because everyone just keeps surpassing you.
They do, exactly.
They're not a learning adult anymore.
No, and that's a lot of passive autism as well.
I remember, you know, just everything that was praised at that job was because of that OCD, but except for when I didn't know how to do a return and press in the right order, this 3-step action, that I kept being called stupid by my supervisor, to the point where someone coming through my checkout, because I just kind of took it, she said, you shouldn't be putting up with that. I'm going to talk to the manager of this store, and I want you to speak to your boss. That is not okay.
Yeah.
And I kind of was shocked, because it come across the same way I've experienced growing up with the people that cared about me, that would point out, hey, you need help with this.
Those
so
people
let me help you.
Are the angels in your life. They are the people who step up and acknowledge and accept the differences and love and support you for that. This article is OCD is often misunderstood. Elena wants you to know what it feels like. It's written by Tessa Fleming for the ABC. That's the article that we've shared today. We haven't been able to get through it into as much depth as perhaps online, but I think we've actually touched upon... No, don't be. Because I actually think we've touched upon that and so much more. And I think that's actually the power of what our channel is. It's a conversation. I hope you've enjoyed today's conversation and got something out of it. If you have, let us know in the comments, because you know what? There's so many really cool insights. And I again want to praise and say, when we know these differences, when we understand what's going on, and we acknowledge that, no, we can't beat the will out of the child. We can't just drug the OCD out of the person.
I just can't understand it because of our son. Like, he used to lash out at me, but I just knew it wasn't from that wrong place.
No.
I just knew.
No,
I mean, yes, the pediatrician was
behavior.
helping me with it all, but I'd get, like, you know, whacked so hard on my face.
Bruises and black eyes, exactly.
You know.
And when we understand, we can then support our
But it
people
wasn't his fault.
through that process. And these things are not your fault.
I actually used to cry during it because it broke my heart.
It does.
Seeing him frustrated.
Absolutely. You can see the little frustration.
Speak.
And I see that in you, which makes me upset because I see you also still
when
locked
I'm in my
and still dealing
meltdown
with that.
because I don't understand.
No, exactly. So thank you so much for imparting your experience. It's incredibly personal, and I appreciate that. I hope that people on the channel also appreciate these little insights, these anecdotes, these stories, because together, collectively, they paint a really big picture of things that have happened, what we're dealing with, and how we can make it better.
You guys are the ones to me that are exactly like the angels that Matt's talking about. Like, you people are giving... You're like, you are listening and wanting to know who I am and accepting me. And that's the same as the very small amount of people I've had in my life, because most people just find you weird, difficult, and don't want to try to work out how you are, like what world you're in, and come into that world.
How can you complement? How can you maximize rather than reduce and impact?
I really think.
Okay, so big thumbs up to you guys. Please give a like to the channel. As I said, if you can share us, it would really help us. And if you're new, don't forget to subscribe, hit the notification bell. We'll see you in another episode real soon. Thank you so much for watching today's episode.